Yes.
Are they related?
They're very much related. As you can see, the title of our book is Could It Be Adenomyosis, the bad cousin of endometriosis. Endometriosis, as I mentioned before, is due to the presence of endometrial tissue outside the uterus. Okay, and this is a dynamic layer, and the endometrial layer is the layer that thickens towards the second half of the cycle. If conception didn't happen, that layer gets shed off, and that's your menstrual period. Now, if this layer has gone outside the uterus, it causes severe period pain. Okay, and sometimes infertility as well, because bleeding outside the uterus can cause inflammation and scarring, so that quite often it causes tubal obstruction and leading to infertility. Now, if the endometrial tissue has gone inside the uterine muscle wall, and that is adenomyosis, right? Some people see this as a spectrum of the same disease. It's just a location of the tissue, right? And the difference is that the endometriosis only causes period pain, but adenomyosis causes both period pain as well as heavy menstrual bleeding. So it's like a double whammy. So I think that's why we call adenomyosis is a bad cousin, because it causes, in addition to period pain, heavy period as well, right? And the two diseases can coexist in a high percentage of women. If you have adenomyosis, you almost have 80% chance you also have endometriosis, and vice versa.
And that's why it's important to know if you have both when getting treatment.
Correct, because quite often women get taken to laparoscopy for investigation of period pain, which is the right thing to do. But if the women also have heavy menstrual bleeding, endometriosis got nothing to do with that. It has to be adenomyosis, and therefore we need to think, how can we diagnose adenomyosis? Certainly laparoscopy treating endometriosis might help period pain, but if there's also coexistent adenomyosis, the heavy menstrual bleeding will not be treated. And that's why we've seen women who have been to laparoscopy, had their endometriosis treated. They still come back and say, I still have some period pain, and my period's still heavy. And of course the period's still heavy because your adenomyosis has not been treated, and sometimes has not even been diagnosed.